Hold on. Before you scream, it's not your portion. Just hold on and listen to what I'm about to say. I know it is not your portion, and it is not the portion of your loved ones, maybe the portion of your enemies. I understand, but you have to listen to what I'm about to say.
All light from him, I hear what they talk.
Now, before I dive into that, I want you to take a look at these statistics. Look at it. Yeah, that is it. Over 2 million people every year because of liver disease. And now I'm going to walk you through how something as common as paracetamol, which is also known as acetaminophen, can lead to liver disease.
Ah,
Yeah, paracetamol is very common. We take it to for mild pain, headache, and to reduce temperature. You get as common as paracetamol. So I'm going to tell you the link between liver disease and paracetamol, and it's something you want to know, right? Now, let's go in. Let's see it. By the way, I'm a pharmacist, so when it comes to drugs, I know better. Okay, so when you take paracetamol, if you take paracetamol tablets, four things actually happen, and that's what we call pharmacokinetics, right? Yes. What are those four things? One of them is absorption. The drug will be absorbed. The second one is distribution. Drug will be distributed. The third one is metabolism, to be metabolized, and the last one is excretion. I will emphasize on metabolism because paracetamol is metabolized into a metabolite that is destroying your liver without you knowing. And that is why I'm here. So that when next you want to take paracetamol, you take it the right way. You understand? So there are three pathways. Yeah, there are three pathways by which paracetamol we take leave our system. One of which is glucuronidation. So that is conjugation of paracetamol with glucuronide. Yeah, and it leaves the system via urine. Then the second one is sulfation, where the paracetamol conjugates with sulfate and it's being excreted via urine. But the last one is what we are talking about, and that is where cytochrome P450 enzymes in your liver metabolize paracetamol into NAPQI. What is NAPQI? Chemistry students. Chemistry students, what is NAPQI? So it is N-acetyl P benzoquinone. That is the NAPQI. So paracetamol is metabolized into NAPQI by this cytochrome P450 enzyme, especially the CYP2E1. Yeah, that is the code for it. That is the code for the enzyme. So now, once this NAPQI accumulates in the body or in the liver, it destroys the liver. There is no other function. I've not read. If you have read where this NAPQI is of a benefit to the body, you can put it in the comment section, but I've not read. So it has no benefit. The only thing it does is to destroy the liver. But the system has something called a substance called glutathione. So this glutathione detoxify the NAPQI and it eventually leaves the system via urine. So glutathione is the good guy, while NAPQI is the bad guy. But what if the glutathione is being depleted? Yes, because it can actually be depleted, especially if you take an overdose of paracetamol. The glutathione will be depleted and you will have accumulation of this NAPQI which will damage the liver. And not just an overdose, listen, not just an overdose that can lead to depletion of glutathione. Now, there are drugs we refer to enzyme inducers. So these drugs induce this enzyme, especially the cytochrome P450 enzyme, which I've mentioned, it induces them to metabolize drugs faster. When you take these enzyme inducers together with paracetamol, what does that mean? So paracetamol, you have more of paracetamol being metabolized into NAPQI, which is the bad guy that we don't want. And I'm going to list some of these enzyme inducers that you should never take with paracetamol. And one of the drugs is rifampicin. It is cytochrome P450 enzyme inducer. And rifampicin is an antibiotic. Yeah, it's one of the regimen drug used in management of tuberculosis, that's TB, and other bacterial infection. We also have carbamazepine. It's an enzyme inducer. Carbamazepine is an anticonvulsant. Yes, and alcohol. I know you don't want to hear this. You don't, but you will. Alcohol is an enzyme inducer. So if you take paracetamol, if there's paracetamol in your system and you take alcohol, the paracetamol will metabolize into this bad guy and it can lead to what we call liver cirrhosis. So are you seeing the connection, the link between liver disease and paracetamol? So paracetamol is not as common as you think. It is not as safe as you think. It is a silent silencer. And you can see the statistics. So that is why I am here to help you know your medication and to take it right. So don't just listen alone. Don't just enjoy this class alone. Don't just gain this knowledge alone. Click the share button, follow us, like and comment. If there is any question, any confusion, clarification you want to understand about what I just said or anything, any drug at all, put it in the comment section. We attend to it. So share it to your loved ones, share it to your friends so that they can also gain the same knowledge you have gained. See you in my next video.